Hey guys, this is Dr. Nima with Pro+Kinetix Physical Therapy and Performance. I am here today to start everybody off with the Anatomy and Pathology series. So, to kick it off, we're going to talk about a very common area of tightness and an area where people feel a lot of tension, a lot of stress in the neck and shoulder blade area, likely due to these muscles right here. It's called the upper trap. So if you ever feel any stress or tension in the top of the neck and shoulder, maybe after working a long day on the computer, you ever feel the need to kind of massage the neck and shoulder, and then usually you get some relief and it feels kind of good, but it ends up coming back again. This area is actually that thick muscle called the upper trap. So the upper trap begins at the base of the skull, right through here, runs down this thick ligament along the spine, and then goes outwards toward the collarbone area. So you can see it attached there to the clavicle. And then it also attaches to the acromion, which is the tip of that shoulder blade. So at the neck, this muscle helps bend your head backwards. And I'll show that to you here. It also helps tip your ears to your shoulders. So in this case, we're talking about the right upper trap. It's going to tip the right ear to the right shoulder. And you can see the muscle's fibers kind of shorten down here. So at the shoulder blade, it's actually going to help pull your shoulder backwards or retraction. And you can see that here. And it's also going to help elevate your shoulder or shrug it up. So there can be a lot of reasons why the upper trap can be painful or uncomfortable, which then could lead to feelings of tightness or stressful feelings of tension and this kind of discomfort through the neck and the shoulder. As mentioned before, this area tends to be an area where most people hold their stress or tension. So for those who are working at a computer throughout the day, this muscle, amongst many others, will get tight due to having poor posture. Tightness of these muscles could lead to difficulty with concentrating at work, potential headaches due to the attachment site at the base of the skull, and also difficulty with finding comfortable sleeping positions. Poor posture could actually include forward head, which is where the head actually kind of hangs down a little bit. Maybe you're looking at your phone for a long period of time. This rounded shoulders position where those shoulders fall forward a little bit, and also a rounded back or an increased thoracic kyphosis. So it maybe might stick out a little bit more. When the upper traps are working harder than they should, it also could be due to compensation from weakness elsewhere in the body. The traps are actually a group of muscles that include not only the upper traps, but the mid traps, this horizontal muscle here, and then the lower trap, which is this angled vertical muscle here. So when the mid and low traps are weak, you may develop upper trap dominance, and that could also lead to feelings of tightness or pain. Weakness may be due to having a rounded back or increased kyphosis, tight chest muscles or pecs, and poor shoulder and shoulder blade mechanics. And so the pecs are those group of muscles sitting through the front here, and as they get tight, they will pull your shoulders forward as well and kind of round you out a little bit. So, you might find that massaging or stretching the area can help temporarily, but we're not actually treating that root cause. The root cause can actually be what we were talking about above, whether that's poor posture, mid and lower trap weakness, or compensations from other muscles causing muscle imbalances. So at Pro+Kinetix, we perform a full body diagnostic, including an extensive evaluation of the problematic area, manual therapy or hands-on techniques to help relieve your symptoms, and then finally an extensive exercise routine to help maintain that relief, improve your posture, and also strengthen weak muscles to prevent that problem from returning. Thank you, and see you guys next time.